A new study examining air samples from hospital wards with COVID-19 patients has found the virus can travel up to 13 feet (4 meters). It is twice the distance current guidelines say people should leave between themselves in public. The preliminary results of the investigation by Chinese researchers were published on Friday in Emerging Infectious Diseases, a journal of the U.S. Centers for Disease Control and Prevention (CDC). They add to a growing debate on how the disease is transmitted, with the scientists themselves cautioning that the small quantities of virus they found at this distance are not necessarily infectious. The researchers, led by a team at the Academy of Military Medical Sciences in Beijing, tested surface and air samples from an intensive care unit and a general COVID-19 ward at Huashenqian Hospital in Wuhan. They housed a total of 24 patients between February 19 and March 2. They found that the virus was most heavily concentrated on the floors of the wards, perhaps because of gravity and air flow causing most virus droplets to float to the ground. High levels were also found on frequently touched surfaces like computer mice, trash cans, bed rails and door knobs. Furthermore, half of the samples from the soles of the ICU medical staff shoes tested positive, the team wrote. Therefore, the soles of medical staff shoes might function as carriers. They found that virus-laden aerosols were mainly concentrated near and downstream from patients at up to 13 feet, though smaller quantities were found upstream, up to 8 feet. Encouragingly, no member of the hospital staff was infected, indicating that appropriate precautions could effectively prevent infection, the authors wrote. Aerosolization of the coronavirus is a contentious area for scientists who study it, because it is not clear how infectious the disease is in the tiny quantities found in ultrafine mist. The contaminated droplets containing the virus are said to be droplets that would in most cases quickly drop to the floor or a surface after exhaling. Therefore it was thought the particles would not remain airborne long, and after a few minutes the virus would no longer circulate in the air and become inhaled. The World Health Organization has so far downplayed the risk. U.S. health authorities have adopted a more cautious line and urged people to cover their faces when out in public in case the virus can be transmitted through normal breathing and speaking. Scientists in Japan also discovered that microparticles could be causing coronavirus to spread much faster. Simple conversations in close proximity could spread the virus without coughs and sneezes.
Experts are now looking at this new infection mechanism as the key to preventing the further spread of the virus.
ただの会話の中で感染が広がっているとか、ある程度の距離があってもそれが広がっているような、そういった事例を見ると、通常の飛沫感染だけでは説明できない、非常に小さな粒子ということで、マイクロメーターの粒子、マイクロ飛沫感染とも呼べるような、そういった状況が起きたんじゃないかなというふうに考えられます。
So how does this take place? NHK is conducting an experiment with a group of researchers.
はい、レーザーください。
The team will track particles in the air using laser beams and a high-sensitivity camera. This technology allows us to detect droplets as small as 0.1 micrometers wide. The experiment starts. First, sneezing. We can see a large droplet about 1 millimeter in diameter. It quickly falls. But let's look through the high-sensitivity camera.
バナナボートとか乗ったら楽しいですよ。
いや絶対楽しい、ね、
めちゃくちゃ楽しい。僕、
We ran the same experiment on a close-range conversation. People generate a lot of microdroplets when they talk loudly. The droplets between these two stay where they are. They don't drift away. It's not yet known what volume of microdroplets leads to infection. But Tateda says we can't rule out the possibility that microdroplets have spread the virus to some extent.
そのマイクロ飛沫、小さな粒子の中にもたくさんのですね、生きたウイルスがいて、大きな声での会話、あるいは激しい息遣い、そういった中でですね、このマイクロ飛沫ができて、それが近くの人、その人が吸い込むことによって感染が広がる、そういったリスクが見えてきたものと思います。
The risk of infection through microdroplets becomes even greater in a closed space with poor ventilation. This lab is simulating the movement of microdroplets in an airtight room. About 10 people in an enclosed space the size of a classroom. A person coughs once and spreads about 100,000 droplets. Large droplets are shown in blue and green. Most of these fall to the ground within 1 minute. But the microdroplets, shown in red, continue to drift. This simulation uses only microdroplets. 5 minutes later, 10 minutes later, 20 minutes later, the microdroplets are still floating in place.
空気がよどんでいると、つまり空気の流れがないということで、マイクロ飛沫そのものは、落ちたり、違う場所に動くことはできませんので、長時間その場所にとどまるっていうことになります。
But there is a way to prevent this stagnation of microdroplets. Opening windows and increasing air circulation is believed to be effective. When you open a window, microdroplets are quickly swept away. They're very small and light, so any airflow will get rid of them.
できればですね、2箇所開けて風の流れを作ってあげるということが大事。それが1時間に1回でもいいから、そういうようなことをやることによって感染のリスクっていうのはかなり下げることができるようになるんじゃないかなというふうに思います。